Over to Dr. Ghulam Ali now, who will make his presentation on the epidemiology of low vision in our country. Dr. Ali. Change करना पड़ेगा.
Good morning, everyone, and thanks, Dr. Sanjeev. Let's begin with understanding the definition of the low vision. WHO first defined 6 categories of visual impairment in 1973, and they say visual acuity between 360 and 618 is considered low vision. This is a magnifying area. Highest is 618 and lowest is the less than 360. Consider low vision. That means category 1 and 2 are considered as a low vision. Because of the fallacies in the previous definition, the working group of WHO met in 1992 again and adopted category 3 and 4 to be included as a low vision. So the working definition of low vision is a person as a low vision if best corrected visual acuity in the better eye is less than 618 to PL or a visual field of less than 10 degree from fixation, but who uses or is potentially able to use vision for the planning or execution of the task. People with low vision are legally blind, and at the current point in time, no surgical and medical treatment is available to improve vision, and they are eligible for the all government benefit made for the visually impaired person. Although they are legally blind, but they are not totally blind because they have some residual vision. In one study in 1991 at Jodhpur, in blind school, that saw 95% of people with low vision have some level of usual sight. Here there is no cut-off visual acuity. Looking at the residual visual function in such patients, the government of India came up with a functional definition of low vision, which is a person with low vision means a person with impairment of visual functioning even after treatment or a standard refractive correction, but who uses or is potentially capable of using vision for the planning or execution of the task with appropriate assistive devices. In essence, low vision is a level of visual disability that cause difficulty in carrying out everyday tasks, and its consequences are debilitating and include patient experience loss of self-esteem, decline in general health, and increased risk of the depression, injuries, and mortality, and it incurs a lot of expenses on the government. And then the question is, why do so many patients go untreated? And answer is because of barriers to the low vision care. Most important is the lack of training and knowledge in the low vision care, a lack of awareness about low vision services, non-availability of the low vision devices, lack of motivation among the ophthalmologists and the optometrists. Low vision care is time consuming, and most of us busy in the providing general ophthalmology services, cataract surgery, etc. And low vision care is not lucrative, and low vision services are not effective in helping patient. That are our thought. So recent studies, now I come to the epidemiology part or some data I am going to share with you. Recent study by WHO has demonstrated that there are 253 million people are visually impaired, out of which 217 million people are moderate to severe visually impaired, and these are people who are required low vision devices. This is a global map showing the prevalence of low vision, and the prevalence of low vision in India is 1.6%, and it falls in the category of moderate prevalence. These are the some diseases which causes the diminution of vision. Sorry, it's not visible now. Like retinitis pigmentosa, diabetic retinopathy, chorioretinal degeneration, retinopathy, retinal dystrophies, corneal scarring, corneal grafts, etc. In this section, we have seen that we learned the definition of the low vision, and there are several barriers to the low vision which we need to overcome. Now, overcome to Divyanshi, na?